Some symptoms of strokes can be weakness on one side of the body, but unfortunately, the stroke symptoms can vary depending on what part of the brain is affected. So the most common types are paralysis or weakness on one side of the body and face, but you can also have things like difficulty speaking, you can have visual loss. If it's a massive stroke, you can even just collapse or pass out. On the other side of the spectrum, you can also have what's called subclinical strokes. What that means is a small part of your brain actually did suffer some damage, but you don't notice because it's not necessarily symptomatic, because it affects a part of the brain that's not so critical and or is redundant enough where your brain is able to compensate. Now the problem is the smaller subclinical strokes over time can build up until it does become symptomatic, and in that way it's very insidious in effect. And so the common example is something called multi-infarct dementia, which obviously happens in older patients, and that's because different parts of the brain have suffered all these smaller strokes over the years, and it leads to a type of a dementia.